Most people think health checkups are always a good idea, but what if I told you that after a certain age, some of them could actually put your life at risk? It sounds strange, I know, but the truth is, not all screenings and tests are harmless. In fact, some of the most common checkups offered to older adults may lead to false alarms, unnecessary stress, and dangerous procedures. That's not fear-mongering. It's something more and more doctors are beginning to acknowledge, especially when working with patients over 70. The medical world is waking up to a new reality. One-size-fits-all testing can do more harm than good as we age. In this video, we're going to take a close, honest look at 5 specific health checkups that seniors are better off avoiding, screenings that even experienced doctors often turn down for themselves. We'll explore why these tests are so commonly recommended, the hidden dangers they carry, and the better alternatives that keep you informed without putting you at risk. You deserve medical care that respects your age, your body, and your quality of life. If you're someone who cares deeply about your health, but also wants to avoid being over-treated, over-medicated, or overwhelmed by today's healthcare system, this video is for you. We're not here to scare you, we're here to empower you with knowledge, confidence, and a clearer picture of what truly supports your health after 70. Let's begin. Number 1. The colonoscopy trap. Colonoscopy has long been considered the gold standard in preventing colon cancer. But after age 70, especially in people without symptoms or family history, this test can quietly become more harmful than helpful. What was once a life-saving screening in your 50s or 60s can, past a certain point, turn into a source of unnecessary risk, stress, and even hospitalization. Why? Because the procedure itself is no small matter. It involves full bowel prep, sedation, and the insertion of a scope deep into your intestines. That's taxing enough for a younger adult, but for older adults, the risks go up significantly. The bowel cleansing process alone can cause severe dehydration and electrolyte imbalances, both of which are dangerous in seniors. And the sedatives used during the procedure can linger longer in an older body, leading to confusion, dizziness, and an increased risk of falls. But there's something even more concerning. Many older adults, especially over 75, are subjected to follow-up surgeries or treatments after a colonoscopy finds small polyps that may never have caused harm in the first place. These slow-growing abnormalities often take 10 to 15 years to develop into anything serious. And for someone in their 70s or 80s, those years may never come into play. Yet, the discovery creates fear. It sets off a chain of procedures, biopsies, repeat scopes, even partial bowel removals, all in the name of prevention. But when the risks of these interventions outweigh the benefit, prevention becomes harm. Here's an example I'll never forget. A friend of mine named George, 82 years old, active and sharp as a tack, was talked into getting a routine colonoscopy even though he hadn't had any digestive issues. During the prep, he became severely dehydrated. After the procedure, he was groggy and confused, fell at home that night, and fractured his hip. That one test led to months of rehab, medical bills, and stress. And guess what? The scope found nothing. This isn't about blaming doctors. They're doing what they were trained to do. But medicine is evolving, and we have to evolve with it. If you're over 70 and not experiencing any symptoms, it's perfectly reasonable to say no to a colonoscopy. There are non-invasive stool tests now that are safer, easier, and effective for many. It's about weighing the true cost, physically, emotionally, and financially, of putting your body through something that may not actually help. We must stop assuming more testing always equals better care, because after 70, better care often means fewer interventions and more thoughtful choices. You're not neglecting your health by being cautious, you're honoring it. Number 2, the annual full-body scan mistake. There's something seductive about the idea of a full-body scan. Having a machine look through you from head to toe, uncovering every hidden issue before it becomes a problem, sounds like smart prevention, right? But for seniors over 70, this approach can be more of a curse than a blessing. While the intention behind full-body scans may seem proactive, the outcomes they produce often set off a domino effect of fear, invasive tests, and even unnecessary surgeries that can shorten your life, not lengthen it. Let's be clear, full-body CT scans and MRIs aren't your typical screening tools. These are powerful technologies designed to pick up everything, and I mean everything, including harmless abnormalities that would never affect your health or lifespan. These so-called incidental findings can turn into ticking time bombs in your mind. A small nodule here, a shadow there, and suddenly you're on the merry-go-round of follow-up appointments, biopsies and specialists, all chasing something that might never have mattered. Why does this matter more after 70? Because the older body doesn't respond the way it used to. A biopsy that would have been simple at 45 can now lead to a collapsed lung, an infection, or weeks of recovery. Even something as routine as lying still for an MRI can be physically exhausting or painful for older joints. And the emotional toll is something many don't talk about. Seniors often carry the burden of worrying about what might be rather than enjoying the health they actually have. Take the case of Betty, a 78-year-old woman I met during a senior health seminar. She was vibrant, walked every day, and had no complaints. But during a health fair, a mobile clinic offered her a discounted full-body scan. They found a tiny lesion on her kidney, so small it hadn't caused any issues and likely never would. But the word lesion was enough to ignite panic. Within a month, she was in surgery. The aftermath, months of recovery, a drop in energy, and lingering complications that never quite went away, all for something that might have remained silent forever. Medically, it's called overdiagnosis. Emotionally, it's called unnecessary fear. And financially, it's draining. Full-body scans are rarely covered by insurance unless there's a clear reason. Many seniors end up paying out of pocket, thinking they're buying peace of mind. But what they're really buying is a ticket into a system that may never stop testing. But responsibility in this chapter of life looks different. It means trusting your body a little more. It means listening to how you feel, not just what machines say. And it means recognizing that not every shadow on a screen deserves your energy or your fear. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3, the overuse of cardiac stress tests. For decades, the treadmill stress test has been considered a go-to method for detecting heart disease, especially in older adults. The logic is simple. Push your heart and see how it responds under pressure. But after the age of 70, that logic can backfire in a way many seniors don't realize until it's too late. What was once a useful tool in your 50s and early 60s becomes a questionable and sometimes dangerous procedure once you pass a certain age. The reason? Cardiac stress tests in seniors often yield what doctors call false positives. That means the results may suggest you have a heart problem, when, in fact, your heart is working just fine. These misleading results happen because, as we age, our bodies naturally change. Arteries stiffen, blood pressure fluctuates more, and electrical patterns in the heart shift, none of which necessarily indicate disease. But the stress test doesn't know that. It just sees something unusual, which can trigger a cascade of fear and further testing. That cascade can include angiograms, catheterizations, and in some cases, even stent placements or bypass surgeries, all of which come with real risks. For seniors, those risks aren't minor. We're talking about bleeding, kidney injury from contrast dye, and dangerous drops in blood pressure. Surgeries become harder to bounce back from, and complications multiply. What starts as a simple treadmill test can end with you in a hospital bed, wondering how it all happened. Let me tell you about George, a 74-year-old retired bus driver. He had no chest pain, no shortness of breath, no fatigue, just a routine physical where his doctor, just to be safe, ordered a stress test. The results came back borderline, and the next thing he knew, he was being referred to a cardiologist. Fast forward 3 weeks, and he was undergoing an angioplasty for a blockage that hadn't caused a single symptom. Within a month of the procedure, George developed a severe infection at the catheter site, landed in the ICU, and spent the next 6 months in and out of rehab. His quality of life has never fully recovered. Now, ask yourself, was that treadmill worth it? The truth is, many leading heart specialists and geriatric associations now recommend against routine stress tests in asymptomatic older adults. They agree that if you're not having any symptoms, no chest pain, no shortness of breath, no unexplained fatigue, there is often no benefit and significant potential harm. That's especially true when your goal is not to live forever, but to live well. Psychologically, there's something very persuasive about the idea of checking your heart. The heart feels central to who we are. It's the drumbeat of life. So naturally, we want to make sure it's healthy. But here's where wisdom comes in. Healthy aging isn't about chasing every tiny potential problem. It's about listening to your body, maintaining your independence, and avoiding the kind of medical overreach that can take more than it gives. That doesn't mean you should ignore your heart health, far from it. But instead of jumping onto the treadmill at your doctor's office, focus on the fundamentals. Daily walks, balanced meals, staying socially connected, and managing your stress. Those are the things that truly support your heart after 70. Not machines, not wires, not tests designed for people half your age. What we need more than anything in this season of life is discernment. The courage to say no to something just because it's available, the wisdom to understand that not every test is a gift. And sometimes declining a test is the most life-affirming decision you can make. Number 4. The pitfalls of routine colonoscopies. There's something unsettling about the idea of colon cancer. It sneaks up, often with no warning signs, and by the time symptoms appear, it can feel too late. That's why, for years, colonoscopies were praised as one of the most important preventive tools in modern medicine. But here's the reality. Many people aren't told that after a certain age, particularly beyond 70, the risks of colonoscopies often outweigh the benefits. And for some seniors, this test can cause more harm than good. Let's start with the procedure itself. Colonoscopies require full sedation, and for older adults, anesthesia carries serious risks. Your liver metabolizes medications more slowly as you age, and your brain becomes more sensitive to the effects of sedatives. That's why older patients are at greater risk for something called post-operative cognitive dysfunction, a fancy term for lingering confusion, memory issues, and brain fog that can last for weeks or even months after the procedure. Then there's the bowel prep. If you've ever had a colonoscopy, you know what this part is like. Drinking large volumes of powerful laxatives that flush your system. But for seniors, that process can be dehydrating and disruptive. It throws off your electrolytes, messes with your kidney function, and can leave you feeling drained both physically and emotionally. One wrong step and you're dizzy, maybe even falling down in the bathroom in the middle of the night. That's not an exaggeration. Falls related to colonoscopy prep are more common than people think, especially in seniors who live alone. And yet, perhaps the most overlooked issue is this: the time horizon of benefit. Colonoscopies are designed to detect slow-growing polyps that might, over the course of 10 to 15 years, develop into cancer. But if you're already in your 70s or 80s and you've had prior clean screenings, the odds of those polyps turning into anything dangerous during your remaining years are extremely low. In fact, many medical associations now say that the potential benefit becomes marginal, while the chance of complications like bleeding, perforation, or adverse drug reactions increases significantly with age. Take the case of Eileen, a 78-year-old retired school teacher. She had a clean colonoscopy at 68 and again at 73. But at 78, her doctor suggested one more just to be safe. She agreed. During the procedure, her colon was accidentally perforated, a rare but serious complication. She underwent emergency surgery and spent nearly a month in the hospital. Eileen survived, but she never regained the same energy, and her independence diminished. She often says she wishes someone had warned her that the test might not be worth the price she paid. Why does this happen? Part of it is medical habit. If something worked at 50, it must still be good at 75, right? But aging changes the equation. What once protected us can later burden us. And the fear of cancer, while valid, often leads people to overlook their real goals in this chapter of life: staying mobile, mentally sharp, and emotionally well. No screening test, no matter how advanced, is worth sacrificing those pillars for a marginal gain in longevity. What matters more at this age is being alert to symptoms that are actually present, like unexplained weight loss, persistent abdominal pain, or blood in your stool. In those cases, yes, investigation is absolutely warranted. But in the absence of symptoms and with a good prior screening record, a routine colonoscopy may not only be unnecessary, it may be dangerous. This is where we must reclaim our agency. Being informed means understanding the trade-offs, not just accepting procedures because that's what you're supposed to do. Your body has earned the right to be treated with care, not subjected to risks that no longer bring proportional benefit. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 5. Overuse of routine cardiac stress tests. There's something about heart disease that makes it feel like a ticking time bomb. You hear stories of someone who seemed healthy one day and then suddenly collapsed the next. So it's only natural to want to catch any issues early. That's why cardiac stress tests, those treadmill or chemical tests that monitor your heart's response under pressure, have become so common, especially among people over 70. But here's the surprising truth. For many seniors, especially those without any cardiac symptoms, these tests do more harm than good. The idea behind a stress test sounds reassuring. You walk on a treadmill, they track your heartbeat, and if something looks off, they take action. But the reality is more complicated. Most people over 70 already have age-related changes in their cardiovascular system: mild stiffness in the arteries, a little plaque here and there, or slower recovery time after exertion. These are often normal signs of aging. But when they show up on a stress test, doctors may interpret them as red flags, prompting further testing and even unnecessary procedures like angiograms or stent insertions. That's where things get risky. Those follow-up procedures aren't without consequences. Catheterizations can lead to bleeding, stroke, or kidney damage, especially in older adults with fragile blood vessels and reduced kidney function. And once you go down that road, it's hard to turn back. One test leads to another, then another, and before you know it, you've gone through a cascade of interventions for a condition that may never have caused you any problems in the first place. Take Harold, a 76-year-old grandfather from Illinois. He was feeling fine, walking daily, playing with his grandkids, no chest pain or shortness of breath. At his annual checkup, his doctor suggested a stress test, just to be sure. The test showed a minor abnormality that led to a cardiac catheterization, which revealed some non-obstructive plaque. The doctors placed a stent anyway. After the procedure, Harold developed a complication from the blood thinners, landed in the hospital with internal bleeding, and spent the next 3 months recovering, all from a test he didn't need, based on a problem that wasn't urgent. So, why does this happen? Part of it is fear. Fear of missing something. Fear of what might happen if we don't act. But at this stage of life, it's important to focus on quality over quantity, preserving energy, independence, and comfort rather than chasing problems that haven't even shown up. Many respected cardiologists now advise against routine stress testing in older adults who don't have symptoms. The evidence just isn't strong enough to support it. It doesn't reduce heart attacks. It doesn't lower mortality. And for those without active signs like chest discomfort, shortness of breath during minimal exertion, or dizziness, it's not only unnecessary, it's potentially dangerous. The smarter path is symptom-based care. If you're having changes in how you feel during activity, fatigue, pressure, racing heartbeat, then yes, evaluation makes sense. But if you're feeling steady, sleeping well, and staying active, your body's already telling you a more accurate story than a machine can. As we age, we must shift from aggressive intervention to thoughtful observation. It's not about giving up. It's about living wisely. You don't need to fight every possible disease. You need to protect your time, your clarity, and your dignity. Final thoughts. Growing older doesn't mean growing helpless. If anything, it's the time in life when we're finally wise enough to question the system, to slow down and ask, is this really for me? You see, in a world that glorifies more checkups, more screenings, more pills, sometimes the bravest choice is doing less. And not out of neglect, but out of deep understanding, out of knowing your body, your values, and your goals at this stage of life. Healthcare in your 70s and beyond shouldn't be a conveyor belt of automatic tests and impersonal routines. It should be a conversation about what matters to you, how you want to live, and what risks you're truly willing to take. Blindly following protocols designed for younger bodies can rob you of energy, peace of mind, and even years off your life. Not because the doctors mean harm, but because they're trained in a system that often chases disease instead of honoring health. If this video made you think twice, if it gave you a new lens to see your health through, then it's already done its job. And remember, saying no to certain tests doesn't mean you're ignoring your health. It means you're being deliberate. You're weighing the benefit against the burden. You're recognizing that not every test leads to clarity. Some lead straight into the maze of overdiagnosis, anxiety, and unnecessary treatment. So take ownership. Talk openly with your doctor. Ask whether the test is likely to change the outcome or just the paperwork. Think about your time, your energy, and your comfort. Because at this age, those are precious. You've earned the right to live on your terms, not fearfully, but thoughtfully. Not overloaded with procedures, but empowered with knowledge, and not constantly preparing for sickness, but actively creating a life of meaning, joy, and connection. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.